Good afternoon, students. Myself, Dr. Umia Pathan, Assistant Professor, DYPCOP College of Physiotherapy. In previous lectures, we have discussed about massage to the upper limb. In this lecture, we will discuss massage to the face and scalp. Facial massage is usually given with the patient in supine line, and he or she should be given a pillow under the knees as well as a pillow under the head at the end of the couch. The practitioner sits at the head of the bed. Check constantly as you work that as the patient relaxes, the head does not sink into a pillow, causing the neck to extend and face to tilt. See, this is the starting position for face and scalp massage. Preparation of the patient for face and scalp massage. Ask the patient to remove outer clothing from the neck and shoulders and to remove shoulder straps. Necklaces and earrings should be removed. Spectacles must be removed. But discuss the removal of contact lenses with the patient. They must be removed if you are using essential oils. If the hair is too long or likely to obstruct during massage, it can be restrained by headband. Ask the patient to lie down and cover the body up to the subclavicular level if he or she wishes. First, we will see face massage. Most of the manipulations are performed with the fingers or finger pad, and it is important to control the control the position of the rest of your hand, including the thumb, so that you do not rest on the patient's face. Ensure there is only medium to light pressure and avoid the throat and thyroid area. Manipulations that may be used are effleurage, fingertip kneading, wringing, plucking, tapping, vibrations to the exit foramina of trigeminal nerve, vibrations over the sinuses, occipitofrontalis stretching to obtain scalp movement, and last, clapping to the area of platysma. First, we should start with effleurage. Effleurage is directed from the midline of the face to just below the ear or subauricular glands, taking care that as you effleurage, you do not constantly move the earlobe. Pressure should be moderate to light. As much of the palmar surface of the hand as possible is used to start the effleurage. The finish is always with the finger pads as the palm lifts to clear the ear. After each effleurage stroke, back gently to the next starting position. The first effleurage goes from under the chin. Use your full hands for this. Okay, you just see in this picture, patient is using full hands from chin to the earlobe. The second effleurage starts with the fingers spread above and below the mouth. Use your full hand. The third effleurage starts at the nose. Use your fingertips to start, then your full hands. You can see in this picture. On a small face, the second and third effleurage are often combined. In the fourth effleurage starts in the midline of the forehead and curves downwards. Use your full hands and repeat for a fifth effleurage if the forehead is high. Okay, you just see in this picture, patient is doing effleurage from the midline of the forehead, okay, and then coming down up to the earlobe where he drains the part. After effleurage, you start with kneading. The line of work are similar to those for effleurage, proceeding from the midline to subauricular area with moderate pressure, returning to the next position with a gentle stroke. The first line under the chin is done with flat of the fingers, which are also used on the cheeks to finish the next three movements. See in this picture, therapist is doing kneading to the cheeks. Okay, after kneading to cheeks, then start the chin to ear line is started with two distal phalanges. Next, the upper lip to ear line is started with one finger pad. The nose to ear line is done with one or two finger pads. On the forehead, 2 or 3 lines are performed with 2, 3 or 4 finger pads. All the manipulations are performed with a lifting pressure upwards and inwards, so that the delicate muscles are not dragged. After kneading, you start with wringing. This is a fingertip wringing performed between the finger pad of index finger and thumb. It is a very small manipulation. Start at the corner of the mouth and work out to the ear. Then across the chin to the other ear. Now work back to the mouth, out to the ear from the nose on one cheek. And across the forehead in 3 lines to the opposite ear, into the nose, and you are back at the start. You can see in this picture the therapist has started bringing from that patient's left corner of mouth. From left corner, it is written 1. From left corner, he started going down to the chin, then again to the right corner of the mouth, then from cheek, then he has gone over the forehead at the line of your eyebrows. After that, again back to right side of forehead, again left side of forehead, from left side of forehead again coming down over the cheek and end at the left corner of mouth. After bringing, you start with plucking. Plucking, it is a stimulating manipulation performed by the tips of the thumb and index finger, in which the tissues are literally picked up, that is grasped and let go very quickly. If tissues were held longer, you should be pinching, so avoid that. Plucking may be performed with one or both hands simultaneously in a similar work line to kneading. You can see in this picture, therapist is grasping the skin and again releasing the skin very quickly. It is the movement like you pluck the flower, like that. Okay, just grasp and release, grasp and release, and it is performed with similar lines as you done in kneading. After plucking, start with tapping. Tapping is performed with the fingertips. Either 1 or 2 or 3 fingertips are used according to the size of the area of the face being treated. If 2 or more fingers are used, they may be tapped simultaneously or in a rapid succession, as in striking 2 or 3 adjacent piano keys. The light tap should be firm enough to cause slight indentation of the skin at each tap. Note that the simultaneous use of 2 or more fingers is likely to be heavier than sequence tapping. The lines of work are those used in effleurage. The work may be performed on both sides of the face simultaneously or one side of the face at a time. After tapping, start with vibrations. Exit foramina of trigeminal nerve. Fingertip vibrations may be performed using either index or middle fingertip over the points of exit of ophthalmic, maxillary and mandibular division of trigeminal nerve. They emerge respectively from suborbital notch and the infraorbital and mental foramina. The fingertip should rest lightly over the exit, and constant vibrations of small dimension are performed until discomfort diminishes. This technique is used in treatment of both trigeminal neuralgia and tension headache. Over the sinuses. If the tip of your fingers and thumbs are held bunched together and your hand is raised so that the ends of the fingertip rest on the skin, vibrations can be performed over a circular area. The fingertips can be placed over the area of the frontal sinus and of the maxillary sinus, and static vibrations performed to encourage a mechanical effect on the sinuses when they are congested and perhaps blocked. The patient can be taught to perform this manipulation and may find that the frontal sinuses are cleared best when he or she is upright, and the maxillary sinuses are in the sideline position. The right sinus is drained in left side line, and left sinus is drained in right side line position. After vibrations, you can start with muscle stretching. Muscle stretching for occipitofrontalis. Place the palmar surface of one hand on the forehead and the palmar surface of other hand under the occiput. Move them simultaneously so that the hand on forehead takes from front of the scalp downwards towards the eyebrows, and hand on the occiput takes the back of scalp upward. The movement should be smooth and slow and reversed equally smoothly. The scalp will be felt to move forward and backwards. This stretching movement is of great use in severe headache when the two bellies of occipitofrontalis often remain in painful spasm. After muscle stretching, you start with clapping to platysma muscle. The area below the chin can be clapped using the cupped fingers. Your hand must circle round one another in such a manner that the strike is in a forward and upward direction. Be careful not to touch the front of your throat and work at a brisk speed. The patient may learn to do this himself or herself using the back of fingers. After ending with face massage, start with scalp massage. Scalp massage is given usually following facial massage with the patient in supine lying position. The therapist standing behind as I have shown you I have shown you for face massage. The same position is here also. The scalp massage help ease tension in the underlying tissues and aids relaxation of the neck, shoulders and whole body. First, you start with effleurage and stroking. The therapist places her hands either side of patient's temporal region and cups the head in her hands, drawing her hands round the parietal and occipital region of the head and then gently off the head. After effleurage and stroking, start with kneading. Kneading of entire scalp is performed over the same area as for effleurage and stroking, ensuring there is a definite movement of the occipitofrontalis over the cranium underneath. This helps particularly to relieve tension headache. You can see in this picture, therapist is performing kneading with the tip of fingers or finger pad. Okay. After kneading, vibrations can be given to scalp. Particular attention should be given to the occipital, temporal and frontal attachments of the muscle where there are tight areas. Vibrations are given again over the same area as for effleurage and stroking. Again, this facilitates easing of tension in the scalp and helps relieve tension headache and has a general relaxant effect throughout the whole body.
Okay, so we're going to do a facial massage. Now this is a little bit of aqueous cream. I might have a little bit too much there. I just thought about it, but if I give him easy. It's not going to use the kind of cross-infection. But we'll see, I can work this out. Okay, I have too much on here, but it'll work out. So I'll do something. First contact, which I've already put cream on, which is not great, but actually before I start I would probably have made contact with her forehead, something like that. I want you to look at the way I'm sitting on the chair. If I sit back in the chair, what happens is I tend to slump, and so do all of you because of the shape of the chair. So it's always better to be on the edge of the chair. And maybe even, this feels a little high for me, I might even have a cushion under my bottom so that I'm at the right, I can really move, and it's the same as when you're doing any other massage, you want your whole body moving. So imagine I've done some holds, and now I'm just going to literally pop some of that cream on. And all I'm doing at this stage is just applying that. And if I didn't have any, that's fine too. So I want you to maybe try without and see what's nice. So we were saying about the aqueous cream, it's safe on sensitive skin. It's not going to do any damage there. And you do need to think about what you're going to put on somebody's face. So far all I've done is like an effleurage, isn't it? Effleurage. So stroking across. So any of these stroking across, and then tendency to pull back towards you. Okay? So stroke across, you can go across the eyes. What I want you to do right now is go across your own eyes and see how much pressure you like. You like quite a lot, don't you? Feels quite good, doesn't it? And yet when you come to working on clients, very often people just get really nervous. So if you're really nervous, try with just one finger. Just across like that. If you're not sure about it, but you could easily use thumbs. You use whatever you like. So what I generally do if I'm doing a facial massage is, if I'm applying something or even if I'm just making a whole contact with the face, I'll do that kind of work. Then I'm going to start from the forehead and work down. Okay? Now you could easily work from the forehead down with just strokes from the center out and down the nose. And you can do that all the way down. That's quite nice. Quite like that. That's easy, isn't it? And you can pinch between the thumb and the finger around the jaw. Or you can work more specifically. This is a technique I love. You can do this to your own forehead just to feel what that's like. What you'll notice with anything that I do with the face is that I have my hands quite safely anchored so that my fingers or my thumbs are doing the work. Okay? Otherwise I'd be like this, and that feels a little bit precarious. So I'm going to rest my hands and just use the fingers. Nice, huh? This is a little beauty therapy technique that I picked up. It's like a scissor stroke. Okay. Scissor stroke with your fingertips. And another little beauty therapy technique is this. You had this one done before? Just like that. Now you can do that. I'm working quite lightly, and you can do that in a really slow way as well. Pinch. And the eyebrows. Definitely spend time around this temple area. What muscle do we have coming down?
Temporalis.
And what does the temporalis do? What's it involved in? Chewing. Absolutely. So people who clench their jaw when they're stressed, do you think that this muscle tends to get quite tight? Absolutely. So worth spending a little time around here for sure. If any of you go to the hairdresser and they do lots of lovely head massage stuff, get used to all the things they do, because they do lots of lovely techniques that you can incorporate in your own massage. You know, just think of all the nice things that people could do to you, and then think what you might quite like somebody to do for somebody else. Nice. Making you fall asleep? Remember to include everything, so don't forget the nose, but in a gentle way. The top lip, the bottom of the chin, really so you can squeeze between your fingers and thumbs along the jawline. Working those masseter muscles, you can feel them. If you're not sure where they are, you can get your client to just clench the teeth. And then really, particularly if they've got a problem, they can be very sore in that area. So with Kitty, I can feel a little bit more on the left side. So if I want to spend more time on one side, I can always support and just do a little bit more. What about the ears? Oh yes. Now what you don't want to do is pull the ears too far away from the face because it doesn't feel nice. But you can pull back, pull up and pull down and work around the lobes. Auricular therapy uses all these acupressure points in the earlobes that relate to the parts of the body. So really nice to work those areas. Coming around the back, forwards, stroking. Anything else I've missed out? There's loads, but that would be pretty good stuff. And you can do anything. You can circle. If any of you have facials, they do lots of this kind of thing. You know, it's like really just play, enjoy, play. The other thing that the beauty therapists do is this kind of thing. They'll hate me if they're watching these videos because they're probably not doing it as well as they do. And then what I would definitely end up with is scalp massage. So really coming into the scalp. Notice the body use. I'm not sitting still and doing these things. So you can do everything that you like. So lots of shampooing. You can stroke through the hair. The only thing you have to watch is the side of the hair here where it's fine. You don't want to be pulling too much there. So particularly people with long hair, it's really lovely to gather the hair and pull close to the scalp and pull. What did you think of that? The trick is to come close to the scalp, so come around so you can see. What you don't want to do when you're working with the hair is pull these fine bits at the side, okay? Particularly with someone with long hair, this is just lovely. You come in close to the scalp, you see I'm really close? And all I'm going to do is squeeze and just pull gently. And then to come off the end of the hair, right to the end, is just so relaxing. With someone with short hair, like myself, you come in close to the scalp, really close. So do it on your own hair if you can. So bring your fingers in and go close to the scalp and just make a fist with your hands. Can you feel how you're pulling? And then you just pull away from the scalp. Now that way you don't hurt someone, right? If you start pulling away from the scalp, you've got more likelihood of catching little hairs and hurting. But actually the hair is incredibly strong. I remember seeing one Indian man with long hair and he had it tied in a ponytail and attached to a rope to a lorry, and he pulled the lorry. That's how strong your hair is, right? Yeah. If you get it in the right way. If you catch the little bits at the side, it's horrible. How am I going to finish this? Well, one way. That's one way. Some people don't like hands on them, so you could just bring your hands over. Another point that I'll show you is right in the centre of the head here. It's a Marma point from Ayurvedic ancient Indian practices, right on the top of the scalp here. And what I tend to do when I finish my treatments is to hold that point and just use that as a point of focus before I finish. And then come away nice and slowly. If you were working with the neck, of course, you could bring in the neck again. you know, because you normally may not have people with clothes on, so you could come around the neck and pull through again. All of that would be lovely. Any questions?
How much pressure are you applying?
It depends on what I'm actually doing. So if I'm working here, I'm applying quite a lot of pressure because I think it feels nice. If I'm doing more of the circling, then no. You know, so you can see from the skin's response there, I'm not dragging the skin, I'm just going across the surface, whereas here you can feel, you can see the depth there. Yeah? Any other questions?
How do you exactly pinpoint it?
Don't worry about pinpointing it, it's just at the top. I'm not teaching you that, it's just one of the things I do that you might want to try.
I wear contact lenses, so the pressure on the arm is
So-
to my lenses. But
So one of the things I would check with somebody before doing a facial is if they wear contact lenses. Thanks for bringing that up. So if they've got contact lenses on, then you're just not going to. Yeah. Yeah, but my pressure was not enough to really do anything about it. But you need to check that. Anything else? No? Cool. Done. Excellent.
Sweet.